All right, do I have your permission to share this video with my online DAT course, Corrective Techniques for Movement Dysfunction?
Yeah.
Okay. Hi everybody, thanks for watching my video. The first thing I'm going to do is I want to do a quick static posture assessment, because I'm really, for Jesse here, I'm looking for if he has any upper cross syndrome, because I'm kind of basing some things on some upper cross syndrome. So stand to your side, looking over here. It looks pretty good with his middle ear, lobe of his ear lined up with his cervical vertebrae, the body's AC joint. Everything seems pretty good from the side. Look straight at the camera, turn around, look straight at the camera. And when you do look at Jess here, he definitely looks like his left shoulder is up a little bit compared to his right. So that's something to take note of as well. But see, rounded shoulders, relax your shoulders as best you can, Jess, just sit there. Okay, shoulders look okay. All right, so first thing we're gonna do, Jess, is we're gonna do some transitional movements. And I use the National Academy of Sports Medicine. I'm using these, I'm gonna base some of the exercises I show progressions on some of these movements. And I'll talk about them later when we post about what I see. I'm just gonna keep going through the assessment. All right, face the camera, we're gonna do the overhead squat. We're gonna look from the front, one side, and then the back. So hands up in the air, feet shoulders width, squat down and hold it. Okay, and hold that. Okay, come back up. Now turn and face this wall. And we'll do it from the side. Things we're looking at for is lumbopelvic hip stability. We're looking for general balance. It does look like his back goes in a little bit and has a little curve in his back. Come up and then, Jess. Now face the window, please. We'll do the same thing here. So these transitional assessments, again, they're checking for balance, general sensory motor function, lumbopelvic hip stability. Okay, come back up. Now, I'm going to face the camera again. You're going to do each leg just once here. You're going to put your hands on your hips, and you're going to do a one leg squat with one leg down as far as you can. Just hold it for a second and then come back up. Check that. Check sensory motor. Okay, come down. Do the other one, please. Okay, good. Come up. Now the next three exercises, we're going to do a push, a pull, and a press. Once you get up here, we're going to do a couple push-ups. And when he's doing the push-ups, we're going to see if he's good. Get on up, please. We're going to see if he can do, if his low back sags while he's doing it. So get up here, go down on the ground actually, and you're going to push yourself up, hold it for a second. Do a couple of them if you can. Go right ahead, and you're ready. All the way up. Hold that. Looks pretty good there. Go ahead. Just doesn't look like we have any type of maybe a little sag right there on that one. You need one more after that, son. Hold for a second. It does look pretty good. Okay, come on down. Thank you. At one time, he did look like he might have sagged a little bit, and again, that's showing lumbopelvic hip. Next thing we're going to do is you can get off of there. I'm going to actually not be able to look at you here because I got to hold this. We don't have any place to hold it on. Okay, he's going to do a seated or a standing row, and we're going to kind of look to see again if his low back arches or if his low back rounds, if his neck moves forward, anything like that. Okay, give me about 3. Go ahead. That's good. Nice. Good. One more. Good. Okay, and I couldn't really see that. Just whenever this is going. Now, next thing you're going to do is you're going to do the press up. Okay, it was about 5 press ups, pretty simple one. Later on, I'm going to use this, show some DST variations with this. Just going to do military press.
Very good.
Yep. Okay. Good. Keep it going. Good job. Okay. Another one. Okay. All right. Perfect. Okay, that's done. All right. Now, there's a couple other transitional assessments that we do for the National Academy of Sports Medicine. I'm not going to do all of them, just doing a few that I'm probably going to use a little bit later on. Now, next thing we're going to do is we're going to check some breathing. We're going to do a high-low and a lateral rib cage movement. Now, let's just do your right hand up here and your left hand here.
This is my left.
I'm sorry, yeah. Sorry. Now, just do normal breathing. We're going to look at your hands here. Just you do your normal breathing. One thing I do notice about Jess, do about 5 of these, is he does use his chest a little bit. I have to be cognizant. He did do some work, just did some work here, so he might be doing a little bit heavier breathing. Other one, okay. Okay, good. Now, put your hands down, relax. And I want to see if his ribs move out laterally, lateral flaring of his ribs here. He's just going to breathe when I tell him. You can see that, Mike? Okay, now, take nice normal breaths, okay? Go ahead. Nice. Yes, my hands are, his ribs are moving out laterally. Okay, lateral movement of the ribs. I do see my hands move laterally. I can feel it. Okay, all right, good, Jess. Thank you. All right, now, next thing we're gonna do is I'm gonna have you come up here and lay down. Now your head over here on your back, obviously. All right, I don't want to miss anything. Now, what we're gonna do is trying to teach Jesse how to breathe here correctly. The breathing is important. The main thing is I'm thinking about is I want to stabilize his low back, lumbar, pelvic area, and the best way to do that is through proper breathing, because the proper breathing does activate those core muscles that are always talked about. So now, when you're breathing, you really don't want to use your chest muscles when you're breathing, unless you're working out, that's fine, but it's just normal breathing. What I want you to do is I want you to breathe like you're pushing out through a straw, okay? Or sucking through a straw or blowing up a balloon. There you go, good. Keep going. Okay, try. Okay, do you see some chest movement there? Try not to move your chest here, son. Just use down here. Good, okay, now I'm gonna give you a little manual feedback here. Under here, so just get you here and relax. Now I'm gonna hold, now you wanna push out against my hand. There you go. That kind of works, doesn't it? Manual feedback. Okay. Okay, there you go. Right there, when you're working out and doing things, when our athletes are doing things, we want them to go right in this spot, right here, where they're really contracting those core muscles, and those core muscles are helping stabilize the spine. We all know how bad low back is. All right, that's awesome, thanks. Now, for dynamic stability, DST, dynamical systems theory, we got to add some things to this. The organism is Jesse, okay, and so far he hasn't had any pain. If he had any pain, you have to follow, Cook. What Cook says, if he was doing any of those transitional assessments, he would have, we'd have to stop if he had any pain and address that pain. Maybe we could do other things that aren't causing him pain, but that's something we always have to be cognizant about. So far everything's good, no pains?
No.
Okay. Now, what we're going to do is, this is a little test that Dr. Anderson showed us already. And what this is doing is we're just adding to the task, okay, the DST, Dynamical Systems Theory. We're adding to the task, and we're making Jesse do some more things here. Now, I want you to concentrate on your breathing again, son, and just contract here. Try not to lift your chest as much. You're going to push your thighs out and keeping your elbows down. Push your hands out like you're trying to slap me in the chest here. You can do about 5 of these. Go. Good. Good. Keep going. That's good right there. Good. You don't have to work yourself to exhaustion, but that's good. Now, again, we're adding to the task here. We're making them do more things and concentrate on breathing. I think you're having a little trouble. It's a little harder, so we're going to put the balloon in the mouth. Now, give me a couple. Go. See the difference? Can you feel that? Honestly, I mean, if you can't, yeah, okay. Give me a couple more like that the right way. So the balloon really does work. As people are, people have to just get used to this. This is a new way of breathing. His chest does seem to move a little bit less, and I can feel it. That's what you want to feel. Relax. Okay. All right. Good work there, son. Good job. Now, all right. Let me take that out. No pains, no nothing anywhere?
Nope.
Okay. Good. Now, the next thing we want to do is we are in good shape here. We're going to do this 90-90 position I told you about. So come up here, please. Okay, your hips at 90, your knees at 90, up against the wall. Now, same type of thing, but now for DST, again, we're changing the task. Now, what you're going to do, relax for a minute, take a break, is you're going to push into the wall, not hard, you're not trying to push yourself out, but you're trying to push enough so you're engaging your hamstrings and your glutes, and you're going to also try to breathe while you're engaging your hamstrings and your glutes. We're changing the task again. Go ahead. that was a good one. That was perfect. Okay, again, when you inhale, of course, your chest is going to move. When you're breathing out, you're really not moving your chest much. Perfect. Feel how that stabilizes you? So when you go to work out later tonight, try to keep that in mind. You're much safer if you go less weight, learn how to breathe first. Okay, when you're working out. Okay, good. Everything good there? Now, I'm going to do something, both of these, Dr. Anderson showed us most of these exercises, but we can add to it a little bit. Looking for our weights. I'll use the weights for this. Something. Again, we can add to the task is, again, do like a bench press for this while you're doing it now. We'll add to it even more. Okay, this is another progression we can do here. Okay, same thing. Push in, activate, and go ahead and do a bench press. You're going to do everything. Go
down and up.
Bench press. Bench press, push against the wall, breathe correctly. Good. Feel everything's going well. Good. There's going to be 5 of those. Nice job. This is another progression here we're doing. We're adding dynamic DST, dynamical systems theory. I haven't really changed the environment as much, which is predictability, but we'll get to that in just a little bit. Right now we're just concentrating on breathing, changing. Now that wasn't a good one. I didn't feel that. You probably felt too. You're getting a little tired, right? There you go. Concentrate. Good. Is that 5? We're at 5 there. All right. Good work. Awesome, son. Thank you. Okay. Now, next thing. Now you can slide back here. We're going to do that. The dying bug, or the dying bug. Okay. We get set. Okay. Now come up here. A little more like this. Arms up. You're going to go right arm, left knee, meet them in the middle, and right leg, left arm. Go. Breathing correctly. Contract. Good. Okay. This is working reciprocal patterns. Those PPR, primary primitive reflexes we have. We're going the reciprocal pattern here. That PPR. Trying that. And talk a little bit about that. Keep yourself at 90. Good. A few more. Nice. PPR. Reciprocal reflex here, working your right and left side of your body, which so many of our athletes have to do. Hey Mike, does it tell you the time we're at on the video?
12:39.
We're at how many minutes?
12:39.
Oh, perfect. Okay. I said 20. Okay, perfect. So I want to get moving a little bit here. Now, same thing here, but now we're going to use the ball. Oh wait, you know what? I wanted to use these. I think these are better. Hold it like that. One. Put your hands
Like this? What do you want me to do?
that.
Okay.
Yep. There you go. Now, same thing. Dying bug. Arms up. Now, just same thing, but now you're going to use weight. Touch this part to that knee, and that part to that knee. We are changing again the task a little bit more. We're adding a little bit more to it by adding the weight. Again, environment's predictability. I don't really think your DST, we're changing the predictability here too much. Sure you're contracting there. Again, give me 5 of these. I want 5 of the progressions so we can see. Okay, nice. Good job. We're moving along pretty well here. Okay, I'm going to show a couple other progressions when you're done that one. Nice, perfect one there. Okay, when you're done your 5 here, we're going to move on to something else.
Got one more.
Okay. Now, perfect. We'll take those, buddy. Thank you. Okay, put this under you. Okay. I'm going to do some marching with the ball here. Okay. Now we're actually under for DST. We're going to change the environment here a little bit. It's unpredictable. He doesn't know how he's going to handle this. This is marching. Okay. Marching. Hold the ball up, and we're going to march. Do your march. Go. Each leg means 1, and then each leg again will be 2. Breathe correctly. And now this is the marching. Again, we're the ball, the march, the breathe. Definitely the task is a little bit harder, and we've made the environment. Now I think we've accessed the environment here because it's kind of unpredictable. He doesn't really know which way he's going to go. I guess it's predictable in a sense. He might, he knows it's probably going to be a little unstable, but still he doesn't know which way. I think that's the unpredictability. which is, again, what the environment is one of the constraints of DST. And as far as the organism goes, he's doing pretty good here. Okay, he's doing really well. And he's having no pain. Is that 4 or 5, buddy?
This should be the last one.
Okay, is that. Okay, good. We're running a little short on time here. I want to make sure I don't kill. Now, okay, we did that. All right, now we're going to do one more medicine ball. Let's get off of this. We can also use the medicine ball here. Okay, same thing. And in the readings this week, you're going to remember what to do. Breathe, bone to the left, and you go a little bit here.
Yeah.
You want a little bit of counteracting rotation. Go. Away from me. Just go. I did say in the, some of the readings we had that you want to get like 1 to 2 inch counter rotation, and I'm believing that's coming from here, and that helped. And when we did that, we practiced this earlier, he really did get a little better contraction when he had the counter rotation. Nice. Breathe. Okay. Okay, good. Now he's almost done this. When he's done these 3, I'm well aware of the. I would definitely do the quadruped stance. Up on all 4s, doing that. Plank, definitely. I'm assuming a lot of people are going to do that, so I'm going to try to go and do a little something different. Assuming most people are going to do like planks and the quadruped, which I would absolutely do as one. Okay. Right. Actually, I just thought of something. I do want you to stand up or roll over and get on all 4s for a second for me. This is something I'm just adding. We didn't go over this one. Just get on all 4s real quick. One thing we can do to change the environment for DST is 90 here. What I want you to do is right arm out, left leg out. Kick the left leg out and squeeze.
Right arm and left leg?
Yep. Go. Squeeze. Boom. Do the other side. There you go. Now, one thing we can do here is to change the environment and predictability. Keep going. Is now what I can do is I can give him a little nudge. I can give Jesse a little nudge here. Keep going. This is change. This is unpredictable. Oh, sorry about that. Changing the environment a little bit on them, which is all part of the constraints for dynamical systems theory. Okay, so here's a way we can engage the environment a little bit. You can even have him close his eyes. We could have somebody on the other side. Maybe they could push one time, push even, give him a little push as he's going to change the environment. Careful not to hurt him, obviously. Okay, that was just an extra one I added on. Now, last set down here. We're down here, buddy. Okay. Now, what I want you to do is I just want you to balance on one leg. You can pick whichever leg you want. I want you to balance and stabilize for just a few seconds. Okay. What we're doing here is, this is a little balance board here, and we're definitely using this stability as an issue to change the environment of DST. And it's, he's doing pretty well. How we can change the environment even more is now, close your eyes, son. When you close your eyes, you take the visual out. It's going to be a little harder. Okay, go to your left leg now, please. A little harder there with your eyes closed?
Yeah.
Okay. That, now, you can stable, hold it for about 5 seconds. We don't have time to do 5 whole reps. We're going to hold it for about 5 seconds or so. I want to do a bunch of different things here at other times. Okay, good. Close your eyes. Okay, nice, awesome. Okay, now to add to the task of the DST is now we're going to use the body blade, and we can use it in all 3 planes, sagittal, frontal, and then the transverse plane. So I'm going to have Jesse do that, balancing on one foot. Okay, and he's going to hold this and go into sagittal plane. Okay, now we have unpredictability, and we have also changed the task now because we've added the upper extremities to it, which is really feeding in to the sensory motor system, afferent information going into our sensory motor system, and being interpreted and sent out as efferent information. Okay, now do it with your eyes closed. We just did unpredictability again. He knows his eyes are closed, but he doesn't know which way he's going to go. He's got to work on balancing. Perfect. Relax. Okay, you need a break.
No.
Okay. Now do the same thing. Now I want you to do frontal plane motion.
Same leg though.
Yeah. Or you can swing. Yeah. Do.
Same leg, right? All
Yeah.
3.
Yep. Okay, okay.
You
good.
said sagittal,
Yeah,
right?
That's frontal. Go. You're
But
good.
this was from one.
That's sagittal. Go. You're good.
Okay.
That's frontal plane. Okay. Just my belief that the frontal plane is a little bit harder for everybody to do. Breathe. Right. Always maintain a breathing. I should have told you that a little bit earlier.
I have.
Okay. Good. See how it's helping you? It all makes a difference in your back.
Yeah, it makes it a lot easier.
Nice. There you go. I did not tell him to say that. Okay. Awesome. Now let's switch. You can switch legs here, and we're going to do transverse plane now. Little bat one, like the bat.
On a different leg?
Yeah, use a different leg now. We're running
All right.
low on time here,
Good to see.
so I just want to show. So here we're, we would obviously do each thing on each leg. Use all three planes. Do it eyes open, eyes closed. You don't have to be on the board already. He's good shape again. The constraints of the DST, the organism, he's in very good shape, so he doesn't have any injuries to speak of. We can go ahead and be pretty aggressive with our treatments here, our rehabilitations, or just our training. Can you close your eyes now, son? Okay, now he's doing it with his eyes closed. Awesome. Okay. All right. That's pretty much it. That's all I have. I want to thank Jesse and his friend Mike for recording it. On my post, I'm not going to talk about DST. I think I talked a lot about the DST, and Jesse's the organism. He's healthy. If any time we were doing something and it hurt, we'd have to stop and address it. If he couldn't do something, then as an organism, he's the constraint. He can't do a certain thing. We have to back off. We have to take away any of the environment, the unpredictability, make it more predictable for him, which is making it easier for him. Or we have to decrease the task. Maybe he can't do as many movements as he can. So that's we just guide back and forth. If he can't do something, we just dial back a little bit as far as task and environment go. Organism-wise, I see that as an injury. If he's hurt, we have to address that injury first, and then we can go on with the rest of the rehab or the rest of the sensory motor system training. Thank you very much. Thanks for watching the video. Take care.